Now I'm going to set up a couple of patients who have got extensive amount of information in all of these places where you can add extra lines, and we'll show you the current iteration of the printout and what it would look like, and we may see some modifications of this as we get feedback along the way. So I'm just going to pause again and generate an antenatal record that's got a lot of information and a lot of visits, and just show you how it'll print out. It is another patient's record, and this one is one where I've put in a lot of additional lines in all the places on Antenatal 1 and 2 where you could basically go endlessly for how much data you want to put in, how many visits you have, and show you what the appearance will be when you print it out. And so the appearance is fairly similar to what you had before. I'm going to hit the print button, and it's going to generate a PDF. And the PDF is going to look like their traditional form, printed out in a manner that's similar to what it printed out before. But in this case, what you're going to see is that the first 6 lines appear in the normal form. Comments going to appear as before, but there's an additional page. The additional page has additional obstetrical history and his additional comments. The format of how this is going to appear is going to be modified, and this is not the final iteration of what this will be like. But this is the concept is that you'll be able to have more lines if you need them. And the other piece that has been added is that there's a header on each page that states when it was printed, by who the user was at the time, and that it's one of how many pages. So this is one of 2 pages for Antenatal 1, and the second one is page 2 of 2. So it cues you to look that there's more. In the next iteration of the printing, there's going to be a feature that will show the bottom line saying there is more information here. Look to additional pages, and similar for comments and extra comments. That's page 1, and now we're going to go to page 2. I'm going to go back into the antenatal record and switch over to antenatal record 2. And this one I have also put in a lot of extra information in all the different fields. So I've got a lot of risk factors identified. I have used up a lot of lines for subsequent visits, and I've put in additional lines in the ultrasound box than would normally be able to be shown. So now I'll hit the print button here at the bottom, and we'll get a PDF form again. And again, it's got a header printed on today's date by whoever's the user, page 1 of 4. So the first page is the traditional page you're expecting to see, and with the first set of ultrasounds and the first set of visits and the first set of risks. The next page is just the risks that are extra. The next page is the visits that are extra, and the next page is the ultrasounds that are extra. What we're going to see in the next iteration or update is that we'll try to compress that into just one page unless there's a lot more information that can fit on one page, and you won't get separate pages for each section, and it'll just be one extra page for whatever additional information needs to be done or printed, and also you would get a message saying that there is extra information if needed, so you'll know to go looking for it. So that's the functionality in the printing. And one potential change that we're hoping to see is that you might be able to print the entire record, both Antenatal 1 and Antenatal 2, from an option on the sidebar over here. And you might be able to have a print section. You might be able to print both, or print Antenatal 1 or print Antenatal 2 or both. And that would facilitate sending the entire record to the hospital as you need to. And we may also be able to include some of the list of labs or documents that are part of the patient C-chart that are relevant to the pregnancy. Again, trying to make the workflow easier for sending information to the hospital depending on what your institution requires you sending, or to to send to a referring physician if you're sending them off to an obstetrician or a high-risk unit. So I'm going to stop there and hope that gives you some idea of what the modifications have been, where we've put the time and effort into trying to improve workflow, fix some of the bugs that we've all been trying to live with, and increasing functionality, increasing also the ability to get cued to act when results are abnormal, and to be able to access the relevant requisitions and information from within the record without having to leave the record. And this should really facilitate care, and we hope to see improvements as we go, now that we have a bit of a framework to build upon. Thank you for your time.